My name is Michael Yates. I'm Director of Development at Ridgeview Behavioral Health. I've been in public mental health and public child welfare for my entire career, over 30 years. I've been at Ridgeview for over 12 years now. And a couple of things that I'm incredibly proud of that we've accomplished at Ridgeview in that span of time has been expanding access to care. And not just geographically, we have expanded our footprint of service that we provide, but also the manner in which we provide timely access to people in need. And centering all of our staff and our culture around this theme of hope, healing, and recovery has been incredibly important and meaningful to me in my time at Ridgeview. An example I always give about hope is when a police officer is called out to a bridge, and that police officer has been through crisis intervention team training in partnership with Ridgeview, and he's equipped with the skills to know how to connect with that person who feels hopeless. Through that interaction, this officer was able to bring this person to our crisis center. They received the treatment and intervention that they needed to regain hope, to know what it feels like again when they've lived with a feeling of hopelessness for not days, not weeks, months, maybe even years. That's what hope looks like in the face of hopelessness. I always love to share the story about healing where someone approached me at a community event and said, I'm really struggling with my daughter, my teenage daughter. She's isolating herself in the room. She's not coming out. She's nonverbal with us. She always seems angry and irritable. So we connected them with a walk-in clinic. They had an assessment, began family therapy, and following that, 6 months later, saw him again, and he spoke to how positively and how much more cohesion there was between parent and child now. That's healing a relationship. Recovery looks like the person that approached me in the parking lot and said, "Do you work here?" And I said, "Yes." "Well, what can I do to help you?" And she said, "We've been bringing my adult daughter here for months trying to get her help. She always fought, always resisted getting the help that she needed. Today, she's finally acting on that and getting the help, and she was admitted to your inpatient hospital. You never ever said, don't come back. You never said, recovery ends here. You never said, if you say no again, you can't come back. You always said, recovery can begin here. Keep coming back. When you're ready, we'll start the journey with you." This adult daughter has now begun that process. That's what recovery looks like. Look, we know if you're hurting, if you're in pain, if you feel broken, if you don't know where to begin, that's where we come in. We've created lots of different ways in which you can connect with us. You can call us. You can come in to see us during the same day walk-in hours. No appointment necessary. You can reach out through chat. We've got lots of different ways because we know people have different ways that they feel comfortable of connecting, of inquiring about, how do I get better? I feel horrible. My thoughts are jumbled. I don't know what sense to make of what's going on around me or in me. That's why Ridgeview's here, is to help you. So reach out to us. We're here to help. Your care experience, we promise, will be a priority for us.